Correct. And here at Rady Children's Hospital, 9 people just this week were treated for whooping cough, also known as pertussis. Only 1 patient out of those 9 cases were hospitalized. This isn't a new illness. It's been around. There's even vaccinations. What we're being told is that hospitals like Rady are once again seeing more cases like the whooping cough. So this is because many people are no longer taking the preventative measures that were recommended during the COVID-19 pandemic. County officials started to see a spike in September with 12 cases. That number then jumped to 57 in October. The last spike was reported back in 2017. And the year before that, a newborn died because of this illness. Babies are the most at risk since they're too young to be fully vaccinated. A typical case starts with a cough and runny nose for 1 to 2 weeks. Then it's followed by weeks to months of coughing. People can also experience fever. Now, officials say the spike is concerning because many people are experiencing vaccine fatigue, and not many are taking the preventative measures like we were during the pandemic. So they're reminding people of what we learned over the last several years. We talked to an infectious disease specialist at Rady Children's Hospital. He goes into detail about some of the measures people can take.
Don't go to school if you're feeling sick. Don't go to work if you're feeling sick. And if you think you might have been exposed to pertussis or you're worried about your current illness, check with your doctor. Because as I said, we do have medications and we will give them antibiotics. Can be helpful even later in the disease because they'll help stop the spread of the disease.
And I should mention that the most up-to-date cases are the ones from October. We're still waiting for the numbers of November. What county officials have told us is that it's going to be well over 57, so we're expecting another drastic jump this month. Reporting outside of Rady Children's Hospital, Regina Urita, CBS 8.